So what if you still have teeth, but you can't save those teeth? That means those teeth have to all be extracted. Okay. What's the implant process for them, and what are their options?
So for those patients, and I know a big fear for them is they don't want to go into dentures. You know, they've had their teeth for all these years, they've never experienced a denture, so we want to avoid that. So we have a procedure where we can actually take their teeth out, get their gums healthy, clean out the infection, place the implants, and then in the same day we can still give them teeth that don't come in and out. So with these patients, when they still have teeth, they don't quite have a denture yet, then the options that we have are, first of all, we can take out the teeth, get the gums healthy, clean out the infection, place a couple implants, and then what they can have is what we call a snap-on denture. So a 2 implant supported snap-on denture. Next level from there is we can add a couple more implants if we want some more stability. So instead of what we call a rocker with a 2 implant supported denture, we can have a lot more stability where we add implants in the back and it's not going to move anywhere. Still removable, but a much better option than the 2 implant supported.
Okay.
Same number of implants now. Now we're at 4 implants. So anywhere between 4 to 6 implants, now we can get to the point where we can really offer them the best. And we're same number of implants, but we can offer them a full set of teeth that don't come in and out. And so it's not a denture.
That seems like much better than a snap in, snap out. It's just a little bit more money.
A little bit more money, but what they're getting with it is now they're not having to take their teeth out, and we don't have to cover the palate, and they can eat the foods that they want, and they're not dealing with the same type of maintenance of something that has to come in and out. But really that feel of something natural, if they've gone from teeth and they've never worn anything removable, it's an easier transition because it's just healthy teeth that look great.
But aren't those upper dentures pretty good because they got the suction?
They can be, but what happens over time is you're going to continue to lose bone. And so we start to lose some of that suction, and you have to use adhesive and things like that. But besides that, they cover the palate. And so your speech and your taste and some of these things, they change dramatically. And people just learn to accommodate and compromise really over time. So with the full set of teeth that don't come in and out, they don't have to worry about that.
So no more dentures?
No more dentures.
Like, I mean, do you think this is the future of dentistry, like 20 years, 100 years, however long it's going to take? Like dentures as we know them today will be gone. They'll all be attached to something.
I believe so, just because we have better options. You know, at one point it was a great option, but now we're more concerned with preserving bone and maintaining health and having people, you know, be able to eat and chew beyond just having a good looking set of teeth.
Now at your center, I guess how it's normally done, you told me, you go to one place where they do the surgery, another place where they put the teeth on top, and even in some cases go somewhere else to get them cleaned.
Yeah.
But you do both parts. You've been trained, I guess, in the surgery
and the restorative.
And the restorative, which is giving them a good looking smile.
Absolutely. And
does it save money that way? I mean, less docs involved, I guess?
It can certainly save money, but more importantly than that is we're with the patient through the life of their dental treatment. It's not just, it's not like these centers where they do the treatment and then they've got to go find some other place to help them manage it. We're there at the beginning, the middle, and the end, and so we're along the ride, and so we can do the surgery.
Is that why you do it quicker? Because there's just one guy?
Yeah, and I mean, our team is all on site, so we're not having to coordinate with other providers or other doctors to be able to pull off the treatment. Everything is right there in our place, and so the patient's comfortable, they know who they're dealing with, and then when they're done and once they have their teeth, then we're also there to help them maintain them.
Now, insurance only covers, even the best insurance, dental insurance, only covers a small part, but you're getting, I mean, if you're 65 years and older, Medicare, and you're getting a huge amount, that's what you told me in the green room, covered by Medicare.
Absolutely.
For the right candidate.
So we're my team and I are passionate about being able to help patients, and we understand that dental insurance is really just a coupon. You get maybe $1,500 or $2,000 to go towards your treatment. Well, some of these bigger treatments that involve extractions and maybe implants or any type of full mouth reconstruction, dental insurance isn't really going to help them that much. But if we can build medical, particularly Medicare in this case, then we're able to soften the financial aspect of it for the patient to allow them to get the treatment they want.
Thousands of dollars might be covered.
Thousands of dollars, and it allows
What
them
are some of the stipulations?
Well, for Medicare, you have to be 65 and older. And really, if they've got infection, which a lot of these patients do, and a couple other medical
Okay.
issues or comorbidities, we call it, whether it's diabetes or blood pressure or sleep apnea,
Then they'll cover a good portion.
then they'll cover it because we can make a case stating that this infection is going to impact more than just their dental health. It's going to impact their overall
That's
health.
nice.
So,
And you have financing. Are people financing these things?
all the time. And
I mean, you're not carrying your own, so you have to have decent
yeah,
credit.
so we have third-party financing, and we do that, and it's really, you know, some really great programs that we can offer our patients, because we understand, you know, not everyone has the ability to just pay for treatment all at one time, but our goal is to make it financially feasible for them to do it, because we don't want them to compromise. I would much rather you save up and do the treatment that you deserve and that you want, instead of spending money on something that's really not going to help you. And so that's why we do the financing.